we talked about kind of language acquisition and what normal language development is. This class we're going to dive into language disorders. So this is just a continuation of Chapter 6. First thing we want to talk about is defining what language disorders are. So other causes for the language disorders can either be hereditary or genetic, which means that it's from birth or it runs, within the family, or because of an environmental problem. So in terms of genetics, one example is either Prader-Willi or Angelman syndrome. There's also Down syndrome, which you're probably more familiar with, having an intellectual disability, autism spectrum disorder, or there's a family history of language impairment. And so that's more of a genetic variant of a language impairment, not necessarily because the family has poor language skills, the child has learned those poor language skills. We're talking about something that's carried through the family. And these are very few examples of the types of genetic disorders that can happen that have a higher risk with language disorders. On the environmental side, we know that the environment that a child is exposed to can either cause a disorder or a syndrome, or it can lead to poor language skills. So in terms of isolation, abuse, or neglect, this is Jeannie, right? She was isolated, she was abused, she was neglected, and so she didn't develop those language skills. Unfortunately, it's something that continues over time, and so these children tend to have, not only just poor sentence structure or limited vocabulary, they may also have problems with their social interactions or their pragmatics. They can also have difficulties because of things that happened while they were in the womb, right, in utero. And so because of the mother's use of tobacco, alcohol, or drugs, they can have fetal alcohol syndrome, or during birth, they can have a brain injury and cause cerebral palsy. There may just be that there are children who have a normal variation in skills. So some people excel in language and do very well, and others just take a little longer to catch up. These are our kids that really fall more into that specific language impairment. So to break down language disorders even further, we can look at the different domains of language, right? So these are the phonology, morphology, syntax, semantics, and pragmatics that we talked about in last class. So for this lecture, we're going to skip over phonology and leave that for Chapter 5. But know that if there's a problem in phonology, then there's likely going to be a breakdown in the other areas of language, right? Because it works as a hierarchy. So if there's a problem at the bottom, the higher levels are going to be affected. So what we're going to focus on next is morphology. And remember, Morphology is how we make new words, right? So if a child has trouble making new words or understanding new words, then they're going to have either on the receptive end of language difficulty recalling sentences or following a story, or on the expressive side producing shorter, less complete sentences or utterances, or they might speak without the use of morphological features. So, according to your textbook, right, by a certain age we should develop certain morphemes and produce those morphemes. If by a certain age those morphemes aren't being produced, then we have a language disorder, okay, or a language delay. So some of the things that you might see is that a child leaves off certain elements of a production. So one example is instead of saying we ate yesterday, they may say we eated yesterday. So they have that inappropriate use of the past tense ed. Okay, in terms of following a story, think about when you're telling a story, it's usually something that happened in past tense. And so if they don't quite understand the feature of the past tense ed, they're not going to understand that this event happened in the past. So syntax is how we're putting those words together to change the meaning of the word or the sentence. So if a child has difficulty with syntax, then they're likely going to have trouble following verbal instructions. So think back to last class when we talked about Sally and Susie play school versus play school, Susie and Sally. Right? We haven't changed the words that we're using, but changing the order changes the meaning. And a child that doesn't understand that changing the order changes the meaning, they're going to have difficulty understanding that what they were just given was an instruction. Okay, on the flip side of that, on the expressive, they're going to have trouble putting sentences in the proper order, or they might use short or incomplete sentences. So semantics is what words or sentences mean. And that can be changed depending on how we put those words together, by our inflection, by the context that we're speaking in, and so it really takes a lot to grow our vocabulary. Think about back in your high school when you started really learning those big vocabulary words. It was hard to integrate those into your everyday life because they're very uncommon. So you have to be exposed to those words over and over again to be able to understand them. With the kids with difficulty with semantics, they're going to have a slow growth of that vocabulary, so that it's going to take them a little bit longer to grasp on the different meanings of words. They might also have difficulty understanding when someone is talking about or using different words, especially those that are less concrete or less familiar. For expressive language, they're going to use simpler or more frequently used words, and they're also going to be more concrete words. So they're going to probably lack articles or auxiliary verbs, copulas, or prepositions in their sentences. They'll also have difficulty producing descriptive narratives. So think about when you're telling a story and just one word can change the way that you understand a concept. They're going to have very short narratives. They're going to have very foggy descriptions. They might also have difficulty answering WH questions. So this is the who, what, where, when, why, how. They have to be able to understand the meaning of the question that you're asking in order to use that information and integrate that information into their answer. For pragmatics, this can be, again, receptive or expressive. So for receptive, remember this is our social language. They could have poor attention to the conversation or appear to ignore the speaker. And this is because they don't integrate what's going on in the conversation to know that they need to follow that conversation. From the expressive side, they could have a lack of turn taking or topic maintenance. They might also have poor storytelling, and they may respond in a frustrated, oppositional, or defiant manner. And it's just because they don't fully understand or comprehend what's going on in that conversation or in that social situation. What you should really take away in breaking down all of the language domains and the language disorders is, again, that there is a hierarchy, and if one lower area is affected, it's likely going to affect the higher areas. And we have to identify what area is really broken or disordered so that we can target that and work our way up from there. In order to do that, we have to assess the patient or the child to determine where the breakdown is. So for assessment, it's pretty extensive. Most assessments last at least 3 hours, and during that time, you're getting a client and family history that includes a medical history and a case history. So what's going on in this patient's or this child's life? What's going on? Do they have any diagnoses that have a higher incidence of language disorders? Is there a family history of language disorders? How many children are in the family? If the family interacts with them very often, and where they spend the most time at? Are they at school most often? Do they spend most time at home with the parents or time with the grandparents, or in some type of after-school daycare? We also do a client and family interview. Some of this is to see how they interact with each other, their perspective on the language abilities, how they're functioning, different things like that. And then we do an oral mechanism exam, and that's looking inside of the mouth to see if all of the structures are there to be able to speak and produce the sounds correctly. And we also do a hearing screening. Now, the oral mech exam is because we know that children who have articulation disorders are more likely to have language disorders. It doesn't mean that every kid with a language disorder has an articulation disorder, or every kid with an articulation disorder has a language disorder, but it is something we have to look at. As far as hearing goes, we've talked about hearing before. Hearing is not only so that we can hear what someone is saying, it's also for our feedback. So if we can't hear that we're making errors, if we're not hearing everything that someone is saying, then we're going to miss out on parts of language. And if we have an underlying problem with hearing, we really have to address that first and then move on to language. When we're measuring language, we're also going to at least do a speech screening. So this is again because children who have articulation disorders are more likely to have language disorders. We want to see if they fall at least within the range of normal for speech behaviors. So when we talk about an assessment versus a screener, screeners are just a quick little checklist of do we meet the minimum criteria of language or speech production for our age. An assessment or a test is really much longer. So these are the 3-hour ones, and they are usually standardized. You want to use a standardized language test. And it's really looking at all of the domains of language, and it's also looking at the modalities. So spoken versus written, verbal versus nonverbal, and expressive versus receptive. And we want to look at all of these areas and see if the kid is falling within the appropriate age ranges. Now, on a standard language test, it's really a lot of very straightforward questions, and the child either has to repeat a sentence or they have to interpret the meaning from the sentence, different things like that. And so it's very, very structured. So what we have to do on the flip side is get a conversational sample, because standardized tests do a really good job of breaking down where the deficit is, but we have to see how that child functions in everyday conversation. If they can't carry on a story and they're 11 years old, then it's likely that they're going to have a problem, but we have to see where that problem is based on the standardized test. So they work together. When you're getting the conversational sample, you get it with a clinician, and you also get it with a familiar person. Usually it's the parent, but you want it to be in an environment that stimulates language. So you don't take them outside into an open field. You're usually going to have them in a clinic room or in their home, surrounded by lots of toys and lots of things that they can interact with to get a really rich language sample. After that assessment, you write the report, and that includes your recommendations for treatment and the outcomes from that assessment and which domains of language are impacted or modalities of language. One way to assess language is using the mean length of utterance, and this is used for a conversational sample. So mean length of utterances have to do with morphemes. So this goes back to the very foundation of language domains, right? Is how we put words together. So in order to measure that, you get a conversational sample of at least 100 words, and then you count up the total number of morphemes and divide that by the total number of utterances. So remember, if we have an utterance that is 5 words, we might have 7 or 8 morphemes in that utterance, right? And so those aren't 100% one-to-one, okay? And it gets more complex as we age. So in order to compare these against our other peers, we have something called Brown stages. And so Brown is a researcher who studied his children over the course of a few years, and then he documented the morphemes and at what age his kids developed these morphemes. And so this chart right here breaks it down into the stage of Brown. So there are 6 stages, and we have each stage there on the left. Then we have the mean length of utterance in the middle. So when we divide the morphemes by the utterance, what number do we get? And if they fall in that age range, then we can see, okay, if it is a 13-month-old and they fall in the 12 to 26-month age range, then they're normal. But if we have a 48-month-old and they're falling in the 27 to 30-month age range, then we really have a difficult problem, right? This tells us that there's likely a delay, and this means that we have to go on to our standardized assessment. In terms of treatment, our treatment is based on our assessment. So we really have to have an in-depth, thorough assessment in order to determine what we need to treat for language disorders. Treatment overall is very diverse, and it's planned according to the patient. So language disorders can vary from mild to severe, and so severe language disorders are going to have a very different treatment approach from a mild language disorder. And that can be in terms of how often we're seeing the patient, what areas we're targeting, if we're sending home homework, who's getting involved. So it's really an overall type of thing. It's also according to how much the child can handle. So if the child is of a lower cognitive status or has a developmental disability, then we're likely not going to do very intensive, overwhelming language therapy. We're not going to throw that kid into a room with 100 toys because they might get overwhelmed. The opposite side, if we have a typically developing kid with a language delay, we might have those, focused 50 toys that they can interact with so that they can at least choose 1 or 2 during that session to get the language sample from. There are lots of different treatments out there. We'll talk about them in class, but very few have actually been experimentally tested and found effective. So you have to be cautious when you're doing language treatment. It's easy to look at a speech pathologist and say, oh, they're just playing with kids. It really is, it's structured and targeted so that you can elicit everything that you need to within a session and help that child grow. Overall, the goal of treatment is to improve conversation or make it so that the child can meet their academic demands. This is especially important in school systems where they only qualify for speech therapy if it has an academic impact. The treatment targets mimic the deficit. So if there is a deficit in the morphology portion of language, then we're going to have treatment goals that are specific to morphology. If the child has a receptive language disorder, then we're going to target goals that elicit that receptive language. But all of our goals and all of our targets have to be functional or relevant to the child. So functional therapy are those that immediately improve the child's communication. It doesn't matter if you think that learning the word coagulated is important to a 2-year-old, because how often does a 2-year-old have to use that word? We have to have things within their environment that are important to that child so that they can associate those words with their environment and those around them. To determine goals, we use something called the zone of proximal development. And essentially what that says is we look at what the child can do independently, so where they're at the very beginning of the assessment, and then we also kind of stimulate them to see what they can do with help. Whatever's in between those areas is called the zone of proximal development, and that's really where our goals start. we're doing a hierarchy to improve those outcomes over time. So if just at the very basics the child doesn't have first words, but with a little bit of help we can get them to say some sounds or some animal sounds, then we can move forward to help them grow into saying, instead of moo for cow, they can actually start to say cow. Another way to look at this is in terms of scaffolding. And so what this does is provide temporary support to the child, and then gradually withdraws that support over time as the child becomes more independent. So there are different ways to do that. You can do that with acknowledgement, which means that if the child says, dog, you say, yes, I see the dog. Expansion or expatiation explains or elaborates on difficult concepts. So it's kind of modeling how to make an inference or interpret what it is. So if a child says dog, they say, oh, he's barking so much, maybe he's scared or angry. And that really opens up the conversation for the child to discuss. So is he scared or is he angry? Then we have a close phrase, and it's kind of this expectant pause at the end of a sentence. So if there's a dog in front of you and the child's just kind of sitting there, they're not really saying anything, you can say, that's a big, and leave that pause there and open for them to finish your sentence. There's also binary choice, phonetic cues, and semantic cues. So a binary choice essentially gives us two choices, right? That's a big dog, or is it a cat? Or phonetic cues say, remember, phonetic cues are the very basic just sounds of words, so we give them a little hint. That's a big duh, right? And you just wait expectantly so that they say eventually dog. And then we have semantic cues. And semantic cues, remember, are those words and the meaning of those words, so we can do something or say something related to the target word. So the target word is dog, and instead of saying that's a dog, or the dog says woof, you say, what is that? And the child just sits there and you say, it says woof woof. And so they can associate that meaning of woof woof, or the thing that says woof woof, to the word dog. So from this class, hopefully you've learned that we have defined what language disorders are. We've discussed the different causes of language disorders and how they can occur either with a developmental delay or a disability or without one. And we also discussed assessment and treatment planning. When we meet in class on Tuesday, we'll discuss further treatment planning.